I have a question for everyone. So the big beautiful bill passed today. My question to everyone is, once these cuts go into effect and millions of people lose their health care and rural hospitals close, the ERs are absolutely flooded with sick people. There are massive healthcare worker layoffs. Does the general public really feel that nurses are going to be resilient this time around? And I say this because of how poorly nurses were treated during the COVID-19 pandemic. With the cuts to Medicare and Medicaid, hospitals are going to be forced to eat up the cost some other way, and it's going to be with less nursing staff. We are already working in very unsafe conditions. It is projected at this time that by 2027, 900,000 nurses will leave the profession. And I fully expect this number to go up exponentially with these cuts. I work in a time in healthcare where I didn't think it could get worse, but it is going to get worse. And then my question to those who want to go into nursing, are you still going to do it?
The Supreme Court just cleared the path for Trump's executive order to lay off massive numbers of federal workers. This isn't a hypothetical. This decision means agencies like the CDC, NIH, FDA, EPA, HHS, and even the Department of Veteran Affairs can start cutting staff right now. Why should you care? Because these workers aren't just pushing paper. They include scientists, nurses, infectious disease experts, environmental health analysts, data engineers, people who keep the country running in quiet, critical ways. Healthcare and science in this country rely on consistent protected federal employment to function. Skip or strip that away, and you're not just shrinking government, you're dismantling the infrastructure that monitors pandemics, approves life-saving medications, ensures veterans get care, and keeps clean air and water safe for all of our communities. This ruling hands sweeping power to the executive branch to fire career civil servants, even those with deep expertise who are meant to be insulated from political retaliation. Justice Ketanji Brown Jackson was the only one to dissent, calling this decision, quote, hubristic and senseless, end quote. And she's right. This isn't reform, it's erosion. Imagine a pandemic hitting tomorrow. Now imagine our top disease surveillance staff being gone. Imagine trying to get a new drug approved, but it takes 3 times longer because the FDA is gutted. That's what's coming. This decision affects all of us: nurses, patients, researchers, veterans, and families. If you care about public health, environmental safety, medical research, or the science behind the systems we rely on every day, this ruling just put it all at risk, and it's happening fast. Stay informed, stay loud, and don't let people pretend this is just about cutting bureaucracy. This is about dismantling the backbone of federal healthcare and science in America. Nursing homes won't have to meet safe staffing rules for another 10 years. And that delay was quietly tucked into the big, beautiful bill that was just signed into law. That's right. While some people were celebrating major wins in other areas, a hidden provision in that bill pushed back critical reforms that were supposed to protect nursing home residents. So under existing rules, facilities were going to be required to provide at least 3.48 hours of care per resident per day. So that included 0.55 hours from a registered nurse, 2.45 from certified nursing assistants, and a registered nurse on site 24/7. But these standards were supposed to start rolling out by 2026. But lobbyists from the nursing home industry fought back hard. They said it was too expensive, too difficult, and instead of holding them accountable, Congress gave them a 10-year pass. Now those life-saving staffing mandates will not be enforced until 2034 or later. So this is what this looks like on the ground. One CNA might still be assigned to 20 or more residents. A nurse might only be there for part of the day. And the basic care your loved one depends on, turning, feeding, monitoring, might not happen when it's needed. These delays aren't just bureaucratic, they cost lives. Research shows thousands of deaths every year are tied to inadequate staffing in nursing homes. The system was already failing, and this law just locked in the failure for another decade. They had the data, they had the funding, they even had the rules in place. What they didn't have was the political courage to say elder care matters. So, yes, a big, beautiful bill was signed, but for nursing home residents, that beauty came with a brutal cost. In a previous video, I talked about the so-called Big Beautiful Bill that reshaped how nursing homes operate and how, instead of increasing quality, it drove up administrative burden and corporate control while care staff continue to dwindle. But there's another layer to the staffing crisis no one wants to admit: immigration policy. Under this new administration, key visa programs that once allowed foreign-born workers to fill critical roles in healthcare, especially in long-term care, were quietly restricted or allowed to expire. That includes programs like the H-1C for nurses and reductions in employment-based visas and refugee admissions that historically helped staff these roles. For many facilities, immigrant workers weren't supplemental, they were essential. Immigrants make up nearly a quarter of the direct care workforce in the United States. In some regions, they are the majority. They're the ones helping residents bathe, eat, transfer safely, and manage chronic conditions. These aren't jobs people are lining up for domestically. They're hard, often underpaid, and carry little prestige, yet they're foundational to elder care. So when immigration slows, the impact hits fast. The Big Beautiful Bill added pressure on facilities to meet unrealistic standards without increasing reimbursement or even addressing the workforce supply. But at the same time, restrictions on legal immigration made it nearly impossible to fill vacant positions. That's not a coincidence. It's a compounding problem. Staffing shortages got worse. Facilities were forced to close units. Remaining staff burnt out or left entirely. Residents got less attention, more errors occurred, and families were left with no good options. This is the correlation no one is naming. Restrictive immigration policy plus punitive regulation equals a long-term care system in collapse. If we are serious about protecting our elders, we have to stop treating immigrant workers like an afterthought. They are the system. And until policy reflects that reality, these crises will keep multiplying.
America has decided it doesn't need all these poor people. It doesn't need cheap labor, or it doesn't need that much cheap labor. So what are they going to do? They're going to cut health services. They're going to cut Social Security. And a lot of those people are going to die. And that's a pretty conscious decision.
Would have thought doctors would lose their jobs, but doctors are being laid off as well as nurses. And I've been doing the research, and this is the conclusion that I've come to. The Medicare fees that were being charged to Medicare by hospitals and or clinics were so inflated and so high and had so much profit built in that now that they've been reduced and now they're at the levels where they're supposed to be, the people who wrote the budgets didn't account for this. Therefore, it's going to look like they're losing money and they're not profitable. So like every other corporation out there, when you're chasing a number, if you're publicly traded, the easiest way to get there is to cut staff. And you'll hear these doctors say, I had lines, there was 6 months worth of appointments set up. It doesn't matter. If the hospital doesn't see the profit, the people that get cut first are those that work on salary. So they're going to have to take some time to adjust back down to where they were actually supposed to be, what they were supposed to be billing Medicare instead of the inflated numbers that were being allowed. And that is exactly why we see so many doctors and nurses being laid off, because they didn't account for losing as much profit as they did when they flipped the switch and dropped Medicare cost down to where it's supposed to be.
Metro Health in Cleveland just announced its largest round of layoffs since 2011. cutting 125 administrative jobs, including senior leadership and entry-level staff. The system says patient care won't be affected, but we all need to know that this signals deeper cracks in safety net hospitals. They're also freezing non-clinical hiring, cutting travel budgets, and suspending bonus pay for over 200 executives. Why? Because Metro Health is bleeding financially. $50 million in losses last year, and they expect 2025 to be even worse. They're spending over $1 million a day on charity care alone, while Medicaid funding remains uncertain under the so-called Big Beautiful Bill. CEO Dr. Christine Alexander Rager said more changes are coming: consolidations, closures, and realignment of resources. For a hospital system that serves largely underinsured and Medicaid populations, this isn't just a cost-saving plan, it's a survival strategy.
So I got laid off today. I'm a registered nurse. I've been a registered nurse for 3 years. I've been a home health nurse for the past year. Alongside being a home health nurse, I've also been a healthcare coach remotely. A few weeks ago, I was laid off from my second job as a healthcare coach due to Medicaid cuts. Today, I was laid off from my agency due to my client being cut from Medicaid. Mind you, this is healthcare, one of the most lucrative, job secure fields that you could possibly have. And here we are having nurses and doctors being laid off left to right under this administration. And if you ask me, this is only the beginning. If we don't do something now, things are going to get worse after this. You have groceries increase, gas increase, bills increase, unemployment increase. This is crazy. This is crazy, and something really needs to be done.
In Massachusetts, immigrant healthcare workers are losing their livelihoods overnight. Hundreds of personal care attendants who came through the CHNV parole program have had their legal status stripped and all of their jobs terminated. So at one provider alone, 9 Haitian caregivers were suddenly laid off. 1 in 4 health workers here is an immigrant, and nearly half of home health aides are foreign born. So this isn't just numbers, it's people, families, and their futures. One caregiver from Haiti, named Robert, told his story through tears. He fled violence, studied nursing abroad, and finally arrived in the United States, where he earned certification and secured a job caring for others. And now, without notice, he can't even afford rent. The impact goes beyond individual hardship. Home care providers warn that short staffing could lead to more falls, worsening health conditions, and costly hospitalizations, straining hospitals and families alike. So this isn't a hypothetical. Care providers are feeling the crunch now. This administration stands by its decision, calling this CHNV program recklessly abused, yet health systems, already hanging by a thread, face a trauma worse than any patient, losing their workforce. So this story just isn't about policy, it's urgent, personal, and unfolding.
What up, Nurse Gang? What up, TikTok? So today on Nurses in the News, I think this is my 4th post that says, is it still Nurses for Trump? Gonna stay at the YMCA. Oh, remember that? Yeah, we gonna get rich. Trump about to do it up big for us. Big Daddy T in the house. Daddy's home. Okay. Yeah, Trump just dismantled labor unions for the federal government. Yeah, he did. National Nurses United included. So all the nurses, all the nursing unions, etc. Done. Just like that. No long arbitration process. No, we got to go through just boom, no more unions. We're done with that. You work for the government. I control this thing. No more unions. That's it. You're not going to collectively bargain here. Wow. Just think of all those union dues you guys paid. And I myself was a government employee for 2 years. It was the most toxic job I ever worked. Well, second to the state. I think the state was probably worse. But the union was taking dues, but where were they to be found? You couldn't even reach them by phone, never answered the phone, had to get on with them through email. You guys know I have my feelings about unions. I think they just slap you around and take your money. I think they're pimps, and sometimes they cripple nurses, and I stand on that, Like they said, not all unions, but I'm going to say like 98% of them, outside of the ones in Cali, are kind of corrupt organizations, and I don't think nurses need unions. Nurses, I too had that fear because I was in a union as a state employee for so many years. I had that fear of just, you become brainwashed by it. Oh, if I leave here, what am I going to do? They're fighting for my rights. Oh, what am I going to, the contract, the contract, half of the time they're grieving and striking because they're not even following the contract. I too was brainwashed like that. And then I said to myself, well, hold the hell up. I stepped outside of that comfort zone and got out of that union and realized the RN behind my name is all I need. I'm a professional with education, credentials behind my name. I don't need some Billy Bob who never worked a day in healthcare telling me, I have to pay him to fight for my rights. It just doesn't make no sense when you think about it. And they get behind your back with management. All those union contracts have management rights section in there as well. I see unions as an overseer, like they have for the slaves, to keep the nurses in line. That's what they do. The contract binds you from going out and whistleblowing and doing all this other stuff. Oh, you got to follow the union. You got to see what the union says. Nah, if I get cancer from what's going on in this hospital, I'm getting my own lawyer. There's no goddamn union. But it was Nurses for Trump. He coming after everyone, nurses included. Nurses are being laid off all over the country. And this is directly, I still think he stole the election, but whatever. Some nurses did vote for him.
Ever wondered what happens when nearly half of doctors offered jobs at the VA hospitals say no? That's happening right now. So from January to March of 2025, almost 40% of doctors turned down VA job offers, quadruple last year's rate. And that's just the tip of the iceberg. So far this year, the VA has lost over 600 doctors and about 1,900 nurses. And those numbers are going to keep climbing. That means veterans, many of whom are battling toxic exposure illnesses, are waiting longer for care, and staff burnout is reaching new lows. The VA Secretary, Doug Collins, claims frontline care is safe, but internal warnings and protests paint a different story. Veterans and staff alike say that this isn't just a staffing problem, it's a complete breakdown. If we don't act, our heroes may lose access to the very care that they earn. So share this, push your rep, demand accountability, because this crisis just cannot stay hidden. On October 4th, the University of Southern California and its health system, Keck Medicine, will lay off 89 employees. So that includes 78 workers at Keck Medicine, 10 from the USC Norris Comprehensive Cancer Center, and 1 from their healthcare center. These are not small roles. They're the people who make the system run, from patient care to vital support services. A letter to the staff said, quote, "Despite our best efforts, we were unable to avoid layoffs," end quote. USC says the decision is part of a plan to stabilize the finances of both Keck Medicine and the Keck School of Medicine. But here's the thing. They hadn't said which positions are being cut. So patients and employees are left wondering who will be left to provide the care. And this isn't the first round. Back in early July, USC filed another notice for 55 university job cuts set to take effect on September 10th. They expect most of those layoffs to wrap up by the end of the week, but also warn that because of what they call, quote, the cascading nature, end quote, of restructuring, more positions could be hit. So let's be clear, these numbers are more than just payroll changes. Every layoff means fewer hands to handle patient care, fewer people to support the doctors and nurses, and more pressure on the staff who remain. When hospital systems start slashing jobs, it's patients who end up paying the price in longer wait times, reduced access, and lower quality of care.
What up, Nurse Gang? What up, TikTok? So today on Nurses in the News, Kaiser Permanente, the healthcare giant, is laying off nurses in California. Yes, Kaiser sent out 42 layoff notices to nurses working in outpatient clinics, mainly GI, OB, and mental health at San Rafael and Petaluma. They are giving the nurses 60 days. They're saying that they have about 400 open positions across the health system in California, and the nurses have time to transition into another job within their healthcare system if they want to stay with Kaiser Permanente. They said they have to make these cuts. They just do not have the funding. What are your thoughts? Let's talk about it.
Big news out of Austin, Minnesota. 37 union nurses at Mayo Clinic Austin just received 90-day layoff notices. Mayo says it's because of low inpatient volume and operational changes, but let's unpack what's really happening here. These nurses are all members of the Minnesota Nurses Association, and they were given official WARN notices. So that's the legal requirement when employers plan mass layoffs. But the union isn't buying it. They're calling this a union busting move, and they filed charges of unfair labor practices. So this comes from Mayo Clinic Health System, one of the most prestigious and wealthy healthcare brands in the country. So why are they cutting frontline staff? The very nurses that the patients depend on. So this isn't just a local issue. If you've been following my videos, it's part of a national trend. Hospitals are consolidating services, shifting care away from smaller community facilities like Mayo Austin, and in the process, cutting bedside staff, often while executive compensation keeps rising. Nurses have warned for years, safe staffing saves lives, but decisions like this send a clear message. Profits and efficiency are being prioritized over patient care and worker stability. So here's the question. Is this truly about declining volume, or is it about breaking the union and centralizing power? You decide. Let me know your take in the comments.
What a sad day today at work. So because of the national budget cut, we are letting go of amazing 18 nurses. So I work in the healthcare industry, and we all know that there were cuts happening, and there's just a lot of crazy stuff going on. And so we were told today that our counterpart, the amazing nurses, so they are about to lay off 18 people. And in the next couple of months, we will not be working with them no more. It's just sad. I can't imagine getting news that you are being let go. You come to work excited. You come to work happy because you want to do things. You want to accomplish something. And then later on that day, you'll receive a news. Hey, I'm afraid that we are going to let you go because of this. Man, I can't imagine. My heart goes to you all who are greatly affected with all the cuts. I just hope that in return, you'll be able to find a better opportunity, and in return, you'll be happier and you'll be more successful in life. I hope and pray that will happen to you, and you all take care. And again, my heart is with you all.
Hey everyone, quick update you need to hear. San Diego-based Sharp Healthcare just announced that they're laying off 315 employees, which is about 1.5% of their workforce. This includes senior executives and roles in medical information and marketing. So what's driving these cuts? According to Sharp, the rising cost of healthcare is outpacing revenue. They are also facing state-mandated seismic upgrades and poor reimbursement rates from payers. So bottom line, they say they can't keep up with the economics. Here's what else is changing. Some staff will see reduced hours, and others will be moved into adjusted roles. Sharp says the majority of cuts are in non-clinical areas, so direct patient care won't take much of a hit. Leadership is also fearing the squeeze. Senior execs are taking a 15% pay cut, and the CEO, Chris Howard, is trimming another 10% off of his own salary. So now Sharp is offering severance, extended health care, and career transition support for those impacted, which is better than what some other systems that I've reported have offered. But still, this is a signal that no health system is immune, especially if you're in a non-clinical or even in an administrative role. If you're a nurse or allied health professional thinking your job is secure just because you're not at the bedside, this is your warning shot. So let me know, definitely in the comments, are you seeing cuts at your facility too? And if you're in a non-clinical role, are you making moves to protect your career? Centricare, based in St. Cloud, Minnesota, is laying off 535 employees across its health system, citing significant external pressures such as rising cost and reimbursement rates that no longer cover the true cost of care. These cuts impact 44 locations and represent nearly 5% of its 11,500 person workforce. About 70% of these eliminated positions are administrative and support roles, while 30% are patient care positions. The health system did not disclose exactly which patient-facing jobs will be affected. Some of those impacted may transition into more than 350 open roles within the system. So in a statement, they said that these adjustments are necessary to safeguard the organization's stability and ensure continued delivery of high-quality care. For the fiscal year ending June 30th, 2024, they reported a $19.8 million operating loss on $2 billion in revenue, a steep drop from a $6.1 million gain the year before. The system operates 10 hospitals and more than 30 clinics across central and southwest Minnesota. This move underscores the financial strain many U.S. health systems are facing, where even well-established networks are struggling to balance patient care with sustainability. Big news out of Austin, Minnesota. 37 union nurses at Mayo Clinic Austin just received 90-day layoff notices. Mayo says it's because of low inpatient volume and operational changes, but let's unpack what's really happening here. These nurses are all members of the Minnesota Nurses Association, and they were given official WARN notices. So that's the legal requirement when employers plan mass layoffs. But the union isn't buying it. They're calling this a union-busting move, and they filed charges of unfair labor practices. So this comes from Mayo Clinic Health System, one of the most prestigious and wealthy healthcare brands in the country. So why are they cutting frontline staff? The very nurses that the patients depend on. So this isn't just a local issue. If you've been following my videos, it's part of a national trend. Hospitals are consolidating services, shifting care away from smaller community facilities like Mayo Austin, and in the process, cutting bedside staff, often while executive compensation keeps rising. Nurses have warned for years, safe staffing saves lives, but decisions like this send a clear message. Profits and efficiency are being prioritized over patient care and worker stability. So here's the question. Is this truly about declining volume, or is it about breaking the union and centralizing power? You decide. Providence just laid off 128 workers across Oregon, and they're warning this will not be the last round. This includes unionized and non-union staff across hospitals, research centers, and clinics. Roles cut range from nursing to clinical research, administration, and even lab techs. The reason? Providence says they're under serious financial strain. In the first quarter of 2025 alone, they lost $261 million. They're blaming several things: Oregon's new staffing laws, an increase in required charity care, inflation, and low Medicaid reimbursement rates. Many of their patients rely on Medicaid, but the system doesn't pay enough to cover their actual care. Earlier this year, Providence also faced a 46-day strike over safe staffing, which cost them even more. And this is the second time they've made triple digit layoffs in 2 months. In June, they cut 134 positions. So now they say services will be consolidated to high volume locations. So if you live in a rural area, expect fewer care options and longer drives. The Oregon Nurses Association says that this puts patient safety at risk and it sends a chilling message to frontline workers. Do more with less or you're next. Hospitals are supposed to be a safety net, not a business model built on cutting care. An assisted living crisis just unfolded in North Carolina, and it's every family's worst nightmare. The Heritage at Sugar Mountain had its license suspended after staff reported they hadn't been paid in weeks. Most employees stopped showing up. Only two stayed behind just to feed residents, but neither could give medications. So that means some seniors went without critical medications for days. The state paramedics and sheriff's deputies had to all step in and evacuate all 28 residents. McDonald's was even brought in to feed them during the emergency transfer. Family members were blindsided. Some say they got no call, no warning, nothing. So the state has called it an imminent danger to residents' health and welfare. The facility owner now has 20 days to appeal the suspension, but the damage is already done. And so this is exactly why we need stronger oversight and better protections in long-term care. These are people's parents. Their lives are not expendable.